Iowa pharmacists want lawmakers in Des Moines to do something about how pharmacy benefit managers operate in the state. Now, PBMs are middlemen in the pharmacy supply chain, and they play a part in what the drugs cost. Our State House reporter Skylar Talal is looking at why there's this push for reform.
204 Iowa pharmacies have closed since 2014, according to the Iowa Pharmacy Association, with at least 29 of those shutting their doors just last year. Now other pharmacy owners fear they could be next.
Over the last 6 months, we've had to make the hard decision to transition one of our pharmacies to a telepharmacy. And over the next 6 months, if meaningful PBM reform is not implemented, we will be faced with closing 1 or 2 additional pharmacies.
Kelly Kent with Towncrest Pharmacy Corporation says the problem is they're losing money when they fill prescriptions due to pharmacy benefit managers not reimbursing them the full drug cost.
We are being paid far less than it costs us to buy the drug. And I'm sure it doesn't take anybody very much time to realize that's not a sustainable business model.
Kent says it's causing them to turn away patients who need expensive prescriptions because they're not able to keep operating at a loss. Now lawmakers are looking to fix that through a new PBM reform bill.
It provides transparency in a really murky system. Make sure that dollars in the system actually benefit the patient and bring down their drug costs and their premiums. And make sure that pharmacies end up getting paid what it costs for drugs to be purchased on the shelves, and ultimately provides patient choice in pharmacy, making sure they get the choice of who they get the best care from.
Democrats say they're on board with legislation that lowers drug costs for Iowans and increases accessibility to health care, but want to ensure the bill actually does that.
We're going to be looking at any PBM reform, any pharmacy reform, as how can we make sure people have access to drugs and how to make sure that they're affordable.
This is an issue that's been in the works for years and was finally on the debate calendar in both chambers this week. While the bill never actually made it to the floor, leaders say they're still hopeful some version of the proposal will pass this session. In Des Moines, Skylar Talal reporting.